So hello everyone, welcome to another episode of the Project IMG interview. Our guest today is a PGY1 pediatrics resident, Dr. Nikhil Chowdary Peddi. I hope I got the pronunciation of your name right.
Yeah.
So welcome Dr. Peddi, and congratulations once again on an amazing achievement. Congratulations on matching as a pediatrics
Thank you so much.
resident. So we'd just like to have a brief introduction about yourself. Can you just tell us a little bit about yourself and your USMLE timeline? How did that go? How did you come about hearing about the USMLE? What urged you to start preparing for the exams, and how did you get everything done from medical school to step 1, step 2, and where you are right now?
Yeah, that's cool. Yeah. Hi, Emmanuel. And thanks for inviting me to speak on this channel. I'm very much excited to help as many as IMGs as possible. So yeah, I'm Nikhil Chowdary Peddi. You can call me Nick if that's okay with you. That's easy for you and most of them to pronounce. So yeah, you can call me Nick. And I've graduated from a medical school in the year 2021. That's last year, April. And since then, I've been volunteering with many local clinics and pediatrics hospitals. And I have decided to do USMLEs during my internship year. I'm from India, so the medical curriculum here is we have 4 years of medical school, 4.5 years of medical school, and 1 year of internship. So that combines it to 5.5 years. So I have decided after my final year. So what I did was during the preparation, during the holidays of my final year, I thought I can give a try for USMLE, but I wasn't sure back then. I was okay, that is an option for me to do as well. But during my internship year, I was rotating in NICU. So that really captivated my, the essence of my preparation, I would say.
Exactly.
The day I was posted in NICU, I have been seeing many preterm babies, and that made me realize, because I was born a preterm baby. I was born at 32 weeks of gestation, and back in 97 when I was born, there wasn't many equipment as we have now. The science back then was a little different than we have. It is very advanced now, but back then it wasn't this advanced. So my parents used to tell me, my parents and my grandparents used to tell me while I was growing up that I'm very lucky to be able to get out of that preterm time in that NICU setup. So, but I never understood it really. I thought because I was a kid, I never felt through what has happened. So, but my parents and my grandparents were thorough enough. They used to tell me that you should be grateful for this life. But when I saw that kid in NICU, the same kid, a preterm who was born at 32 weeks, when I've seen the mother's face when she used to come, I was the intern posted there, so I used to interact with the mother every day. So I used to tell her the progress of the baby. So finally, when the baby made out, when I told her that your baby is fine, she's going to be all right, the expression and the gratefulness that I felt from the mother, I think that has completely changed my perspective regarding medicine. That is the day then I decided that I want to be a pediatrician, I want to be a neonatologist. So that is how I decided. I was always keen about research opportunities. When I was in med school, I was very keen about research opportunities. From my second year of med school, I used to go to my professors, whoever I was comfortable with, and I used to discuss certain topics with them. For example, I did a project on diabetes mellitus. We find many cases of diabetes mellitus in India. So I went ahead and I asked one of my physiology professor regarding this, diabetes, what is the pathophysiology of diabetes? What are the other things we can work on it? And we came up with a research project which takes up the monocyte count of a patient, and it tells us if the patient is at the cardiovascular risk or not based on his diabetes.
That's nice.
So yeah, we worked on that project and we published a paper. So from that time, I was very much interested in research, and I want to pursue a clinical as well as research-oriented field. So I felt that USMLE pathway or US residencies will offer much to that arena when compared to Indian residencies. So I chose USMLE back then. After making that decision, I chose USMLEs. And I did 3 of my electives during my internship itself. I came to US and I did 3 of my electives, all 3 in pediatrics. And 1 elective was also associated with a neonatologist. So I've experienced that as well. Yeah. After that, after that, I've come back and I've graduated and I've given my step 2. So coming to my timeline, I've decided it during my internship. So what I did was I started during around April 15th of 2020. April 15th of 2020 is the day I started my step 1 preparation. I still remember it very clearly. So I started on that day, and I have taken my exam on November 11th of 2020.
Oh, that's
I've taken my exam on November 11th, around 7 months of preparation, and November 15th, I flew back to States. I went to States to start my rotation. So in December, January, and February, December 2020, Jan 2021, and Feb 2021, I did my electives, and I came back in March of 2021, and I graduated. And I have taken my step 2 on August 9th, 2021. So that was the day I've taken my step 2. So around 4.5 months of preparation I had, because I started my preparation after coming back to India. After my graduation, I started preparing for step 2. So so from around mid-April, I started my preparation for step 2, and I've given it around on August 9th, I would say. So I've completed back then, and I got certified on September 9th. On September 9th, it took around 1 month to get certification after giving step 2. So I got my result of step 2 on August 25th, and it took exactly 2 weeks from that day to get my certification. And before that certification itself, I was done with OET. I was done with my Pathway 1 application as well. The only thing remaining was my step 2 scores. The moment I got my step 2 scores, within 2 weeks, I got my certification. So everybody has to, I would say, this paperwork is a very big thing. So keeping in mind that it might be delayed.
So you need to plan early.
Yeah, we have to plan early. So that would be my advice for anyone who is applying for next year's math. So try to keep your certification process done, because the rules keep changing every year. And now everybody got used to OET and this Pathway 1. So it shouldn't be that difficult now, because everybody are aware. Because during my senior year, my seniors, when they applied, that was the year when COVID started, and they had a very hurry-burry kind of
so they had to change everything.
Everything was changed. CS was cancelled and OET has come into picture. So everything was a bit crazy back then. But during my year, last year when I applied, it was okay. Everybody were comfortable. And I think now and coming years, it should be even more comfortable. Everybody is accustomed to this new change, I would say. So that shouldn't be a problem. Just keep the timeline in mind and plan early.
That's amazing, Dr. Nick. So you matched into pediatrics. So what made you? I know that you mentioned the reason why you matched into pediatrics, and I think that is an amazing reason. But apart from that experience you have, both personally and apart from the experience you had during your internship here, is there any other factor that you can think that played a role in you picking pediatrics over any other specialty, or was that a very core or key factor for you?
As I told you, I thought I will always go into research field. I never thought of choosing a clinical field per se. I thought after I graduate, I will be choosing kind of research branch and go ahead and continue my research. But during my internship, that internship experience has played a very key role, because that reminded me of who I am, why I was in this field in the first place. So I thought of paying it forward. So I wanted to be the neonatologist who saved me. I wanted to be my neonatologist. So that is the first thought that crossed my mind when I was seeing that baby. And my professors used to be really encouraging. One of my professors saw this for my interaction with the patient's mother, and the last day of my neonatology rotation, he sat down with me for almost 1.5 hours, and he spoke with me very personally. He gave a lot of encouragement. He motivated me to choose pediatrics as well. His name is Dr. Sudarshan Reddy. He is one of NICU specialists in my hospital. So when I did my internship, so he encouraged me a lot. He sat down for almost 1.5 hours, and he talked about his personal experiences, and he told me that I would make a great pediatrician if I choose that branch. And coming such kind of encouragement from your mentors or your professors will always be a good boost.
Definitely, it's a big deal. Yes. So you managed to write, like you said, you were doing your internship here, and you were still in school. You hadn't graduated when you took your step 1. So how did you manage to juggle that? And how do you advise students to be able to do the same? Because, I mean, not everyone is able to keep that.
That's something I understand. Like, it's very subjective. I wouldn't pressure anyone to do it this way. Like, if they are comfortable, like in some cases they are comfortable just extending the college schedule for a few more months and they can take the exam if that is feasible for them. If they are able to manage it side by side along with clinical duties, then that's awesome. They can do it. If they are not, then I wouldn't bother. Like, I wouldn't be pressuring them to do it that way. That is the right way. No, I wouldn't say. The entire USMLE journey is like a complete subjective thing. What works for me might not work for you. So even coming to the resources, it's the same thing. Anki never worked for me. I never used Anki. Like, only one time I used Anki, I couldn't use it properly. I don't know, like, whether I don't know how to use it or the way it was presented. I don't know what's the problem, but I never got connected to it. So what works for me might not work for you. Yeah, that is the one I would say. So it should be.
But how did you manage? How did you manage to balance it for you personally while you were preparing? How did you manage to balance your clinical duties, your internship here with USMLE? Because it must have been stressful. So what were the things that you put in place to be able to ensure that you were well prepared for the exam, and still able to juggle your clinical duties? What were those things that you were able to do?
Yeah, I would say like few rotations are little okay to manage studies, whereas other rotations like emergency duties, NICU, PICU, well as ICUs, we will not be able to do that because we will be 24/7 on call, or 24/7 we should be alert. We cannot risk the patient's life by studying, like by keeping our free time to study. Like, we have to be on call on that time. So I wasn't able to do in those hectic postings, but few postings which are okay to manage with, like family medicine or community medicine kind of postings, where you get a good amount of free time along with clinical duties. During that time, I used to do UWorld as well as FA reading. Okay. But during hectic postings, I never bothered about it. I just kept my USMLE preparation aside. So what happened was, like, it went on and off. And once I was in a good position to take up the exam, then I've taken around I've taken a good amount of break and I did my exam, and then I continued my clinical duties.
Okay, that's cool.
Yeah.
So what kind of US clinical experience do you have? I know you mentioned that all your electives, you did 3 electives of pediatrics and one was neonatology, if I'm right. What was the process of finding your USCEs?
That's true.
And then how many LORs were you able to upload during the process of your matching? How many letters of references were you able to upload?
So pediatrics branch per se, there are only like 209 programs, I would say. There are only 209 programs in pediatrics. And out of that, only around 150 programs, I think, they sponsor visas. Okay. So it's like very limited options. Pediatrics is not a very wide branch in terms of residency programs. It's like there are only 209, and 150 of them are the ones which sponsor visas for non-US IMGs. So it was, you have to choose your program, like even during applying for elective, you have to choose which are IMG friendly or which have a good option of you taking in or getting into that program. But unfortunately, during my time, during 2020, that was the peak stage of COVID. 2020 is the year when COVID has started. So I had no opportunity to go directly via the universities. I had to choose via third-party agencies. So I did my electives, all 3 electives, via third-party agencies itself. And I got to know, now, we have Project IMG, which is sponsoring electives at a very affordable price, right? I got to know that through TEDx, So that was one. I used third-party agencies because I had no other option. I had to get my
at that time, COVID. So, yes.
At that time there is no other option. I have to choose. But now, as the electives are opening up, universities are accepting people. I would say people can just start searching for the required branch and required hospital. And if that hospital is taking in observerships or electives, they can start applying. Because most university electives require at least 4 to 6 months of prior submission of their applications. Whereas third-party agencies, I don't think you need that much of time. You can apply now. As long as you're ready to afford the rotation, you can get the rotation immediately, within a week or 2 weeks also. It just depends upon your affordability.
Okay.
So The
Yeah,
third
for your
party is body.
okay. So for your letter of references, how many were you able to get and upload actually?
So I got like 4 letters of references, all from US pediatricians, like under whom I've worked. One was from that neonatologist, Dr. Emmanuel. She's a very well-known pediatrician or neonatologist in Chicago. I did 2 of my electives in Chicago. So I got 1 letter from her, the other one also from a pediatrician in Chicago, and 2 letters I got from Houston. I worked under 2 doctors in one of my rotations. I worked under 2 different doctors. So when I asked them, both of them were ready to give me individually. I rotated under 2 of them. Like there are 2 of them are 2 unit heads, and both of them were ready to give me LORs individually. I would say like the key should be how you interact with your patients, how you interact with your doctors. If you are cool enough, if you can show that you are really interested, because usually you don't get 2 LORs from the same rotation because they don't give you, because they say that you are rotated only under 1 doctor, so we can't give you 2. But this doctor has come out of her way. She helped me out of her way because she came out of her way to give me this LOR. Because she believed in me, because she thought I'll be a very good candidate. I rotated with her and as well as one of the unit chiefs. I rotated with both of them. I used to rotate outpatient with one and inpatient with the other. Okay. So both of them know me personally well. So both of them have agreed to give me an LOR. When I told her that I'll be applying for this match, she immediately, even before me asking, she immediately volunteered that you'd make an excellent candidate for pediatrics. I would be happy to give you a letter of reference. I felt very happy. Then I told, I would be honored to get one from you.
Yeah.
So you have to maintain this good rapport with your doctor. It's like your clinic rotation that you attend during your medical school. If you show interest, if you show that you are the one for that job, most of them will be happy to give you
LORs also. Yes, definitely.
And you can't expect, the moment you walk in, you can't expect that they're going to give you an LOR.
Obviously.
It doesn't work that way. You have to show your part. You have to show that you are eligible to get that LOR. If they don't feel that you're a good fit for that for a program in pediatrics or for that specialty, they will right out deny it, saying that we won't give you an LOR, or they just say that 4 weeks of rotation is not enough to assess a person. That is a very common reason, they would say. Or else they might just say that they'll give you an LOR and they'll just give you a generic LOR. In the sense that it is an LOR that is used for every other student.
Every other student, yes. So not something personal.
Yeah. So to get a very strong letter of recommendation, getting a LOR is an easy task. But getting a personalized LOR is the one that you have to focus on. Okay. If you're going through third-party agencies, most of them will say that they are going to give you an LOR just because it can be a generic one. They will just give you a generic one. But if you want a personalized LOR, you have to work for it. Okay. You have to work for it. You have to show your interest in that department, and you have to maintain a very good rapport with the staff, including paramedical staff, everyone. You're not just working with a doctor. You're working with an entire staff. You're working with
team, yes.
nurses. You're working with your fellow colleagues. You're working with your preceptor, everyone. I'm still in touch with most of my coordinators, like wherever I've rotated, I'm still in touch. Like when I've emailed all of them, emailed me back saying that you deserve it. Congratulations, you got into our field. Like all of them were very happy. You have to maintain that kind of long-term relationship.
Yeah.
Because most of the times you rotate in one time of the year and you will be asking for an LOR completely different year. Yeah. I rotated in 2020 in one of the hospitals, and I asked in 2021 for an LOR. If they don't remember me, they will be like, they'll just give you a generic LOR. Yes. But I maintained that bond with the preceptor or the coordinator, whoever. Like you have to maintain that bond so that they can say that, this person has rotated here, this person has showed this person has presented this case, something unique about you. They should remember something about you as a unique, because you'll be rotating with 10 other students. And 10 of them will be asking them for a LOR. They have to differentiate you from those 10. So yes. You have to be something, you have to contribute something from your part so that they'll be able to remember you. That is one thing that you have to remember.
Yeah. So I wanted to ask quickly, that does research make any difference? Or does it matter for a primary care specialty like pediatrics? And how much difference did having research make on your CV when you put it into your CV and then during your entire application and interview process? Was it really important, or did it make it stand out for a primary care specialty like pediatrics?
Pediatrics, per se, I wouldn't say that it is going to be essential. I don't say that research is mandatory for pediatrics, unlike for neurology, surgical branches, where research is a mandatory part. Even though they don't say that it is mandatory, but everybody knows that they need some kind of research experience to get into such high competitive. So even though pediatrics is competitive for non-US IMGs, I would say research is not a big part that would play. If you are really interested in research, please go ahead and do research articles or get few publications. Research is always a plus point. It is never a minus. No specialty is going to say that, oh, you have research, you don't fit for my specialty. Yeah, it's always going to be a plus point. It is always going to be a booster for your application. But if you are just applying only for pediatrics, and if pediatrics is your only goal, then I wouldn't say that having research is going to make big difference. If you have research, that's okay. You're good. You're golden. But don't stress much about it. I would say for pediatrics, the one thing that is needed is USC in pediatrics. Your clinical experience with pediatrics is what's going to matter, because pediatrics is not like any other specialty. You are going to deal with an age group where they are not able to express their problems. Children can never tell you that this is their problem, or this is something that is going wrong with them, because they just present you with crying. Most of the time they'll just come to the clinic, they just start crying because they don't know how to express their pain. You have to be the one who has to break that ice. You have to be the one who has to localize what is happening with that kid and come up with the solution. So even parents most of the times will be freaking out. If I have a kid and if my kid is in pain, even though if I'm a pediatrician, I wouldn't be thinking rationally. I would be like, oh my God, my kid is in pain. That bond, that kid and parent bond is very special. And that is something that you have to cherish, and you have to you have to be able to deal with that bond in pediatrics. So that is something that you have to learn. So that I would say that clinical experience in pediatrics is most important than any other thing in your application. Your USC is going to be the highlight, I would say, rather than research. If you are interested, you can get. While applying, I had like 5 publications, I would say, 1 poster presentation and 4 publications in journals I had. And out of that, 3 of them are pediatrics, and 2 of them are like, one is like general, like antibiotic resistance. The rest of the things are in pediatrics. So even if you're having research, I would say try to do something related to pediatrics. Pediatrics is a specialty dependent branch. So whatever you do, I would say do something related to pediatrics. If you are truly interested in pediatrics, try to find volunteering opportunities in pediatrics, because pediatrics have lots of volunteers, at least in our country. In India, we have like infectious disease is a very common problem in India. So we have polio program, we have deworming program. So depending upon your location, you will be able to find at least few of the opportunities. So try to do volunteering in pediatrics. Try to get few. If you are interested, you can get few research articles in pediatrics. If not, that's not a big deal breaker. But if you have, it's okay. If not, then don't worry too much about it. But try to get USC. That is the more important thing, I would feel. Try to make a connection with the preceptor that you work, and because they are the ones who are going to vouch for you in the end. The letter of recommendation is like a letter that they are vouching for you, because the US doctor who has met you is going to read your application and call you for an interview. It's like they're just blindly calling you. So they never met you. They never know you as a person. So to call you, they need someone to vouch for them from that branch. They need a colleague who they can trust. So if you're getting a strong personalized LOR from a US physician, a US pediatrician, then like the program whichever you are applying to might be convinced that, okay, looking at your LOR, they might be convinced, okay, this person is a very good candidate for our programs. Because most of the programs I interviewed with had brought up this topic. Like everybody told that my LORs were very personalized, and they were told like they were very impressed reading my LORs. Most of the time, they just read my LOR and they started calling me for interview. That is what most of my programs I interviewed with specifically told. When they were talking, they told like most of the doctors you worked with were really impressed. Like in fact, the neonatology doctor has really vouched very strongly for you. That is a very strong thing for me. Like the program director at one of the programs that I interviewed, he literally told this. Like they told that this is how, looking at that statement, I was really convinced that you're going to be a good fit for pediatrics. So
so that's very important. Okay.
Yeah.
So we know that this journey going into USMLE and this pathway is really, really stressful, and it can be very mentally draining. So can you quickly just tell us what you did to prevent burnout during this process?
Oh, yeah, that's a very good question, because everybody needs to know this. It's a very long journey. It's like a marathon. It is not a sprint. It is like a marathon. It takes around 1.5 years for most of the Indian medical graduates to complete the entire process and go into a residency program. It's a very long process, and you will not be surrounded by many people who are doing USMLEs. You will be surrounded with your own country people who are doing your own home country residency preparation. So that those two are completely different things. You can never compare yourself with them and feel depressed. That is one thing I would say. Never compare yourself with any of your peers who are not in this journey as you are, because they'll never understand what you are going through, and you will never understand what they are going through. It is just going to create unnecessary panic between both of you. So never compare with them. Even if somebody is calling you and saying that, why did you choose USMLEs? It is a long process. It is going to take a long time for you to settle or somewhere, etc., etc. You don't have to take these things in mind. You don't have to argue with them. You can just say, okay, I understand. Thanks for your concern. That's all. It's you. Ultimately, it's you who is going to take the decision. It's you who is going to go through this entire process. And it's ultimately you who is going to get what you desire. So once you made up your mind, don't second guess yourself ever. Just once you made up your mind, that's all. You have to go ahead. But while you are making this decision, be careful. Take up all the factors that you think are important. Take your financial burdens into your consideration, because this process is costly too. It is not easy. It costs around $20,000, $20,000 to $25,000 for entire thing to go, including electives, including your accommodations there, your flight charges, your visa process, everything, your match process, your applications, everything takes around $20,000. Actually, it took something around that for me. So you need to be you have to look into that. If you're not financially stable, you try to get some loan. I don't know if loans are being possible, or if your family members are ready to help you, that would be great support. My family has come forward and they helped me a lot in sharing this financial burden. So I was able to clear this, and I can blindly say that whatever I am now, whatever I achieved, it is just because of them. Their support is the one that mattered to me. They are really supported. The day I told them that I'm going to take up USMLEs, from that day, they never questioned my decision. They always were supporting. At least some days I felt very low, like, okay, I'm not able to finish this part. I'm yet in this, I'm stuck in this step. I'm yet to do this. So even then they used to support me. They used to be like, okay, you already started it. You compare yourself with a person who has never started it. They're still in a decision-making process. At least you made a decision, you came forward. You have to compare, you have to see the positive thing, because there are going to be a lot of negative things that are going to hamper your way, but don't give in yourself to that. You always have lots of positive things going on. Even the little things that matter, like even just getting a pass in NBME can be a very big achievement for a person who is in the initial stages of preparation.
Definitely.
So just enjoy those. So just enjoy that process. It's going to be, because in the end, once you match, when you look back, you will always be happy. You will be happy that you chose this path, because on March 14th and on March 18th, when you get your March results, nothing else matters. You will be on cloud 9. Mark my words, everyone of you. It doesn't matter in which specialty you match, in which hospital you match, you made it this far. Particularly non-US IMGs who are requiring visas, who have come forward so much, overcoming all the burdens, overcoming all the imposter syndromes, all the financial burdens. The day you see that you match, the day you see that hospital that you have matched, nothing else matters. You will be on cloud 9. All this hard work will be worth it in the end. So just keep yourself positive. And if you have friends who are studying for USMLEs, then be around them. Surround yourself with those people. I had a friend who started along with me. So we did our rotations together. She was an amazing support system to me. She constantly, she'll be applying this year match. She'll be applying this September. So she helped me a lot. You need someone like that. I would say if you have
a solid support system.
Her name is Shravya Uppalapati. I would like to give a shout out to her. I would like to contribute my success to her as well, because she was there in every step of the way. Even though she felt low, because we started together, she was not able to, because of some personal reasons and some issues, like she was not able to do step 1 at the time I was doing step 1.
Okay.
She had to extend her step 1 date. She has to postpone her step 1 date. Even then, she used to support me a lot. When I was taking step 1, she never put me out of track. She always used to support me. She always used to be like, "Yo, you're going to be done, man. You'll be done with this exam. You'll be starting a new rotation. So just be positive." Like, she used to be there for each and every step of the day. She was there for my step 1. She was there during my electives. We did it together. So we were there. We shared accommodation and everything. And she was there for my step 2 as well. While I was taking step 2, she took her step 1. She did well as well. And while once step 2 is done, she was there throughout the credential verification process is a little bit delayed for me. Because my school doesn't participate online. It has to be done via mail, physical mail. So it got delayed a bit, and I was super tensed because I was applying to that match and I wasn't sure that I will be certified or not on time. But she was there. She used to be positive. She used to be like, "Don't worry, it is going to be done." You need someone who used to be who
a strong support system.
Have your back. Yeah.
Yes.
You need to have a strong support system, and no matter what happens, they have to have your back. Even though you are taking a complete foolish decision, they should correct you and they should tell you why you are taking that decision and what is going to what are the consequences. Even if you take that decision, what is going to happen? Like, they have to correct you. Yeah, she was there for me. Like, when I did my step 2, she was there. When I applied for match process, she was there. So I'm trying to pay it forward to her this year. So she's going to be applied this year. So I'm trying to help her as much as possible from my end. So hopefully she matches too next year.
I will hope so too. So you mentioned that you extended your internship, and I just want, like, in a minute, can you just tell us what are the advantages and or disadvantages of extending your internship, even for your electives? So
so I'm not sure if there are any disadvantages or advantages. It just completely depends upon your medical school policies. So, according to my medical school policy, if we are doing an elective, it's a very valid reason because we are still clinically active. We are still considered medical students during my internship. We are still considered a medical student. We are not working doctors. We don't have medical license yet. We are still considered as a part of medical school and medical students. So as long as we are part of medical school, they are okay with us being clinically active in another country as well. So they allowed us to do.
It doesn't matter.
It doesn't matter. So once we did our electives, we come back and we graduate. So it is not it is a very normal part or very curricular part in our school. So it is not a big deal, or it completely depends upon your individual medical school. So in our medical school, they have accepted this policy. So as long as you're considered a part of the school and as long as your medical school is okay with that, you can go ahead and do your electives, because most of Indian medical schools doesn't have connections with US medical schools for them to rotate during the third or fourth years of medical school. They have to finish their third and fourth years clinical rotations in their own medical school. That is that is the rule, I would say. So they always finish their third and fourth years. Once they're done with the core clinicals, then they'll be eligible to go ahead and do electives in the state. So once we finished our core electives, we were eligible to do electives in the United States. So they allowed us to do. We went and we did it. And once we come back, we have to graduate. We'll just have that. There will be a rule based upon our year of internship. They'll give you a specific date on which you are supposed to graduate. So as long as you graduate by that date, it is not an issue. Yeah.
Okay. So what are the future prospects you have? And do you have any subspecialty that you are interested in? I know that pediatrics is yes. Do you have any subspecialty you're interested in? And do you have any more future prospects now that you have matched into your pediatrics residency?
Yeah. So my future perspectives would be take up a Neonatology Fellowship. Once I'm done with the pediatrics, I would like to go ahead and do Neonatology Fellowship. As I've already told you that I want to be a neonatologist. So I'm going to do that.
So that's
apart from that, apart from doing a clinical part from NICU, I would like to improve on advances, latest technology in neonatology. I've already worked on percutaneous umbilical cord blood sampling, and I worked on intrauterine gene therapy as well. Like, I did few research articles on that. So that really intrigued me to pursue a career along with my clinical career. I would also like to have this research-oriented career. So I would like to improve the clinical outcomes or neonatal outcomes in preterms or per se, the pregnant ladies' outcomes. Like I would like to improve the newborn outcomes. I would like to decrease the cerebral palsy cases, ARDS cases. I would like to address all these issues. So neonatology is the one branch which allows me to deal with all these kind of issues. So I would like to do Neonatology Fellowship as well as do clinical research in neonatal advances.
Okay. So finally, in the last 2 minutes that we have, if there was a message, if there was one word you would like to give to all our fellow IMGs who are watching this interview, maybe just one word of advice, what would that be? What would you like to advise all the IMGs watching this interview?
Okay, so I would say just enjoy the process. Don't regret that. You will never regret once you match. You'll never regret why you have chosen this path. So just enjoy the process. Enjoy every minute of this process because it is going to transform you into completely different physician and completely different human being. You will be meeting the people from across all over the world. You will be exchanging your cultures with them. You will be exchanging your mindset with them. It is going to really transform you into a complete human than you were before. So just enjoy this process. Never question why you have taken this. If at all you're in a position where you feel like giving up, just think why you started this, why you have chose this USMLE pathway. Then that question itself will find your motivation. Once you answer that question, you'll find your motivation, why you have chosen this, why you have started this. So that's it. Just enjoy the process as much as you can. It's going to be fine in the end.
Yeah. So thank you so much for this wonderful section, Dr. Nick. It was really an absolute pleasure to share, to hear you share your thoughts and share your journey with us. That has been very, very inspiring for us. We wish you all the best in your residency or your future endeavors to being a neonatologist. We are really, really glad to have you here and have you share your experience with us. So thank you once again, and congratulations once again on
matching. Thank you so much, Emmanuel. Yeah,
okay.
Thank you so much for having me on this platform. Thank you so much.
No problem. Thank you.